This video is going to show the reason why we like to do anterior temporary crowns when it's an implant case. Uh, that's a little bit different when we're talking about the front teeth versus the back teeth. The front teeth, of course, we want it to look really, really good when someone smiles. And so a big part of how a smile looks is going to be based upon not just the color of the teeth and the shape of the teeth, but also the shape of the gum line. So someone, when they're missing a tooth, when a tooth comes out, the bone heals, and then an implant is put in. And the thing is, the gum tissue is kind of flat at that point. We like to use a temporary crown in the front to kind of train the gum tissue or try to get a shape to it so that when we get to the final restoration, it looks like the implant crown fits nicely into the gum line. So let's go through a case real quick just to kind of show what I mean. Here's a site. There's an implant that's embedded inside the bone. It is now healed. The gum tissue is very nice as far as being thick, but you can tell that there's this little bitty hole and there's all this thick gum tissue. Over here, this is a same sort of site. This isn't, I'm sorry, this is the same patient. But look at how big now this hole or this cup, this bowl basically has been shaped of the gum tissue. When you put a crown inside of something like this, it looks like it belongs. It's kind of like if you took an egg and put in some Play-Doh, you know how that Play-Doh would make that shape? That's what we're trying to do with a temporary abutment and crown for an implant tooth on the front tooth. We're trying to create the shape of the gum line. And so we'll go through this case real quick. They came in initially to have this done. Then the patient had a temporary crown put in place. And this is actually a temporary crown right here, believe it or not. On this case, there was actually two of them, this one and that one. And so it's a very nice looking temporary. It almost looks like the final thing. But the point of this is to try to build the right thickness of that site. So here you can see this temporary crown's got the same kind of width and height as what a final crown or what even a natural tooth would look like. Then what happens when that tissue, again, that bowl or that little cupped out area has been kind of shaped from the temporary, then the day they go in and take the impression for the final abutment and crown, here's the impression part. They can either put impression material or some dentists put some kind of other material to kind of capture that shape so that when they send it to the lab knows how to build that crown. So when the crown comes back, and this is a different case, you can just see how this tooth, when it's going to be inserted into the gum tissue, this gum tissue is like a very nice receptacle for that crown. So it looks really nice. Here again, looks like that tissue was trained, a different kind of case. It has that nice little bowl, kind of cupped out shape. Here, looking from the front, look at that gum line. That just doesn't happen naturally on its own. That had some work that the dentist had to work with to try to get that gum tissue to get to that correct shape. What if somebody doesn't have that temporary in place? What does the gum line look like? Now, this would be prior to someone getting a temporary abutment and crown for their implant. The gum tissue, as you can see, it's just kind of flat. It just kind of goes across it. There's a little bitty arch right there, but not much. Here again, it's flat. So if you try sticking a crown, an abutment and crown, and something like that, it just is always going to look like there's something not quite right because the gum tissue doesn't drape around that. Like, for example, look at this one. This was a case that had a temporary abutment and crown in place, and so the gum tissue got formed very nicely. And now look at this tooth. It blends right in. Of course, the lab got the shade right, the surface texture, the base, the color, shape, and all of that stuff looks like it blends with the character of the other teeth. But look at how the gum line looks like it just belongs. Look how a natural tooth goes up and comes down. Here's a natural tooth, comes up and goes down. What we're trying to achieve with an implant is that same kind of goes up and then comes down. So again, it looks like the implant is emerging out of the gums just like a natural tooth instead of just something laying on top of the gums. Again, just to kind of say it one more time, we're trying to shape the gum tissue so it looks like this and it's not just this flat stuff right here. And so that's the reason why we like to do a temporary crown, or maybe you can even call it a transitional crown. If someone goes from maybe a removable temporary that they had during the whole surgery phase, but now that implant is integrated and it's in place and we're ready to get to the final restorative, if we just bypass the temporary and go right to the final, the aesthetic result is much more unpredictable. Whereas if we go with a temporary, now we know in the final result's going to be the best it can possibly be. So that's the reason why we like to do an anterior temporary, or you could call it a transitional abutment and crown before we go to the final one later on. And I also say that it takes just a few weeks, maybe a month or two, to get this shape to be just right. And as you can see from the previous examples, temporary crowns can look very nice. There's a temporary crown. There's another temporary crown right there. So someone can move away from their removable replacement, go into a implant supported, although transitionary or temporary crowns, but they look very nice. They can chew at these things, they can smile with them and talk with them just fine. It's just now they're going to have that time where they're trying to build the gum tissue to be the right shape. So that's the reason why we do that. All right, thanks.